Hi, my name is Dr. Tom Rofrano from the Natural Medicine Clinic in Palm Beach Gardens, Florida. And today I'm going to talk to you about a patient that came in with a very, very, very large thyroid nodule, goiter, and how we were able to help her shrink that by 30% in the first 3 months. And that's just for starters. So I've been practicing now over 30 years, chiropractic, nutrition, functional medicine, and have seen over 100,000 patient visits. And lately, it seems like more and more patients are coming in with autoimmune conditions, especially thyroid, a lot of nodules, and this is just rampant. So we're helping a lot of patients with these, and this one woman in particular, 60-year-old woman, came in. She happened to see a YouTube video that I did with my wife last year, where I was able to help my wife shrink her thyroid nodule by over 50%, fairly quickly, and how we did that. So she saw this and came in. She drove quite a distance to get here, and she had a huge nodule in her thyroid. It was over 9 centimeters. To give you an idea, my neck is about 12 centimeters wide, so that's how big it was. And it had been going on for about 10 years, and she was just feeling miserable. She didn't want to, you have 2 ways to go with this. There's the traditional medical route, which for some people, that's fine. They do surgery I'm not big, they would do surgery to remove the thyroid. And then be on medication for the rest of your life. So, that's one way to go. She didn't want to do that. She wanted to see if she could treat it, if I could help her naturally with this. So she came in, and the first thing we do in our what we call our functional and free program, it's a 7-step program to identify your underlying root cause and provide long-term permanent solutions. So step 1 is a whole body health analysis, where we determine what tests need to be ordered to figure out what's causing this, because you don't just get nodules or a goiter for no reason. It's coming from somewhere. So we do the evaluation to figure out the history, what tests to order to kind of get to some underlying root causes. So to give you an idea, and as far as her complaints, so besides this goiter, she was completely exhausted. She had headaches, brain fog, depression, anxiety, couldn't lose weight. She was very bloated and swollen. She had neck, back, and joint pain, insomnia, sinus congestion, digestive issues, constipation, gas, bloating, the whole gamut of digestive issues, a lot of skin issues, itchiness, and other skin issues as well. So she just from head to toe was really struggling. And so anyway, basically we look for areas, of physical, chemical, and mental stress. So those are the 3 broad areas we're looking at. And under chemical stress, for instance, we test for, number 1, deficiency. So in her case, she had multiple nutrient deficiencies, 9 to be exact, vitamins and minerals, including, and plus she had an iodine deficiency. So iodine is one of those things where, people, it can be very controversial, because there's so many experts saying that iodine is terrible if you have thyroid issues, Hashimoto's, which she had. She had Hashimoto's, which is a thyroid autoimmune condition. So, a lot of people say you shouldn't take iodine at all and avoid it like the plague. And I have, people try and find like iodine-free multivitamins, because they're afraid of it. So on the other hand, if you test for iodine, which we did with her, and it's low, if someone's deficient, she was severely deficient, then it can be really helpful. And as a matter of fact, iodine deficiency is and can be a primary cause of goiter. So anyway, she was deficient in 9 nutrients plus iodine, one of the lowest levels I've seen in iodine, by the way. So that's one area is deficiencies. 2, we look at toxins. In her case, she tested high for 5 heavy metals, including mercury and lead. And whereas most many thyroid Hashimoto's patients are iron deficient and anemic, she was the opposite. She had too much iron in her system. So too much iron is very toxic, like any other metal. Extremely toxic and can damage organs and every other part of your body. So her iron or ferritin level, which is stored iron, represents stored iron in your body, was very high. And then the third category you look at, besides deficiencies and toxins, are infections. So she had, even before she came to me, she had been to a number of different doctors. I mean, she brought in 94 pages of labs and medical records before she even came to see me. So she was positive for many different viruses, and including Epstein-Barr, very common with Hashimoto's and nodules. So then when I did additional testing, we do comprehensive stool testing, and she had bacterial overgrowth in her intestines, and she also had yeast overgrowth. And I often see yeast overgrowth and Hashimoto's / nodules together. I mean, almost every Hashimoto's patient you have has yeast overgrowth. And that went along with her chronic sinus issues and her skin issues. So besides deficiencies, toxins, and infections, if that wasn't enough, because you don't want to just like find one thing. It's usually, oh gosh, when someone comes in with a over 9 centimeter nodule, there's going to be a lot of things going on. So then we look at the fourth category is food sensitivities. And she was sensitive to 10 different foods, plus gluten. She had a very significant gluten sensitivity. That, by the way, she also tested positive for leaky gut. So with these gut infections going on, and gluten, and eating gluten can cause leaky gut, which then in turn makes you much more sensitive to all foods and can cause autoimmune conditions like Hashimoto's. In addition to that, she was sensitive to a number of chemicals, including one that she was exposed to on a daily basis at work. She worked in the cosmetics industry, so she was exposed to that. Anyway, it was like over 12 different specific things we found. So then what do we do from there? So the first thing we do is the diet, all right? So instead of just going gluten-free, basically I put her on a diet. I call it the free diet because it's free of not only gluten, but gluten, grain, sugar, yeast, soy, corn, dairy, legumes, GMOs. So anyway, it's a diet to help reduce those foods most commonly responsible for inflammation, gut issues, and really allow your body to heal. And actually, we're going to put a link down below in the comments to the free diet phase 1. So if you'd like a complimentary copy, feel free to click on that. So that was one step is the free diet. 2, natural medicine formula. So I put her on a number of different supplements to help with these deficiencies she was having. And Iodine as well. Yes, relatively high doses of iodine. Again, don't run out and take iodine. You need to test first to figure out if you need it and how much. So have her taking that. Things to address the yeast, different herbal remedies to address the yeast overgrowth and bacterial overgrowth. Very powerful probiotics we have her on. Supplement, the elevated, heavy metals and iron. Had her start doing infrared sauna to help sweat out these toxins. And then avoid the exposures of these chemicals at work. She also had adrenal fatigue, adrenal stress. Her numbers were really off there on top of everything else, and very high levels of inflammation, and her hormones were off. Estrogen, very high, estrogen and progesterone ratios were way off. So address those, address the inflammation, adrenal, adaptogenic herbs to help balance out her adrenals, and then recommended some lifestyle changes, stress relieving lifestyle changes, things like that. So we put all that together, followed her along, retested to make sure that things were improving, and just this week had her 3-month ultrasound report back. So because I ordered one initially, and then 3 months later, and happy to say this over 9 centimeter nodule goiter shrunk by 30%, and then she had 3 other nodules that all shrank an average of 30%. So overall, the size of the goiter and the nodules averaged 30% reduction in 3 months. So we're both thrilled about that. And this is just the start. I'm planning on continuing this path and continuing to see, and recheck and continuing to see it shrink. And she's very thrilled, obviously, because number one, a lot of her symptoms have cleared up. The fatigue, aches and pains, and headaches, and the 50 other things she came in with, but also this huge mass in her thyroid that changed her voice and made it difficult to swallow. And it was, very understandably very self-conscious about, visibly was shrinking. So she is very happy about that, as I am as well. And we all here at the Natural Medicine Clinic. So anyway, just thought I would share that with you. And so just know that for any chronic health issue, whether you have thyroid nodules, or goiter, Hashimoto's, other autoimmune conditions, or other chronic health condition, you have a choice. You can, choose, to live with it, to maybe take medications for this and that, or surgeries. And that's one choice. Or you can choose health. You can choose to really look into what are the underlying root causes of your issues, address those, and then be provided solutions to have you get better. So thanks for joining me today, and feel free to subscribe to my YouTube channel down below if you want notification of new videos. Also, the link for the free diet phase 1 is down below in the comments as well. So feel free to click on that and we'll send that right over to you. Thanks again for joining me today, and look forward to giving you further updates and seeing you next time. Take care.